This is a technology leveraged solution, and you can see me as a boy with my father. I was a 3-year-old child when I was diagnosed with muscular dystrophy. Why I am saying this is that at the right time, my father and my parents gave me the right interventions, and that was the reason why I am today standing before your good self talking. Otherwise, I would have been, in a corner of a room, dejected and neglected totally. And I also had an inclusive schooling. In those days, there was no special schools in 1974-75. And I did my schooling in rural areas, in Randipet and Chidambaram, in Tamil medium. But the kind of stimulation I got in the regular school was the biggest input for my life. That was the major reason why I was able to manage all the situations and accept the realities of the world. So that's why the World Health Organization also says that if a child with disability is not provided with the right type of intervention at the right time, it will lead to profound exclusion and poverty, and that will lead to a lot of negative consequences. Next. As you have said, there are no good numbers, but whatever is available with 2011 census, time adjusted, it is 30 million children. But more important is 66% of them do not have access to rehabilitation, and 72% of the children unfortunately do not get the opportunities that I have got in my life. They are not able to go to school. Many of the schools today, even the other educational institutions, do not have equal access. We all have barriers. Even I have a lot of barriers in my young ages. Still it has not changed, despite the law that has come. So the major reason for people getting stuck is the lack of access, the lack of rehab professionals. There is only one rehab professional for every 90,000 children with disability. This is an impossible task. So we have to find some ways to find out the solution. And we got in a small way a technology solution to address this, where the bridge between the specialist and the children are the parents themselves. So we train and build the capacities to the parents, and the community workers play a major role. Because a specialist or a professional doesn't have time or bandwidth to train the parents. So we have brought in the community rehab workers as a cadre, and they get the training and they transfer the capacities to the child. So the technology that you have got, it has an inbuilt protocol of all the therapies, whether it is a locomotor like me, or cognitive or intellectually challenged, or autism, or sensory disorders like hearing or visual impaired. Whatever be the issue, we have got a complete protocol of therapies built into the app. So a person with a community worker can screen and assess a child. Then a rehab worker gives a proper treatment protocol for each and every child. Everything happens through the use of the technology. It is a web-based application, and it is used as a tablet by the community worker. All the community worker needs to do is to pick up the child after logging in and find out what the therapy to be provided. And this way, we are able to individualize every child's therapy requirements and make the community worker transform it and give it to the parent, who in turn is able to deal with the kids. And in this way, we are able to achieve 85% compliance with the therapy requirements. And another important factor is the child mother or child parent interactions is increased as high as 95%. Because of the use of this technology, the parents are able to spend time with their children. Otherwise, what happens is when they have to take the child to a center, or they have to apply a very special treatment plans, they lose their time for their livelihood. So this is also resolved. So the entire process is also WHO approved parents facing therapy program, where the entire rehab process of a child is integrated into the life cycle and life system of the family. So this approach has resulted in a very big success. Next. As I just explained, this has cut down the time and distance, it has improved the therapeutic compliances, And in the process, it has substantially reduces the cost, sir. The cost of rehabilitation otherwise is more than 100,000 Indian rupees per annum for a child. But in this way, we are able to cut it down to rupees 25,000 per child per annum, sir. The reason is most of the rehab specialists, their services are spread to many number of children. One therapist will be able to handle 100 children, and this is they are able to achieve because the community workers are involved and parents are taking the responsibility. In this way, even though the number of therapists and specialists are less in number, we are able to cover more number of children, sir. So ultimately, over the period of years, we have developed this technology into a full platform, sir. So in this platform, anybody can log in and become a service provider, whether it is an NGO or whether it is a government department or whether it is an individual therapist or anybody who has a knowledge on rehabilitation can do it, sir. And this provides an end-to-end solution, sir, not only for the therapist but for the management, sir. It is an end-to-end solution for managing a program. It is a complete individualized medical database and a platform for planning and budgeting, monitoring, because it provides a live monitoring. Because of the GPS, it tracks every worker live if they are on the field. If it is on the center or otherwise, it provides a daily check-in and check-out, which helps the monitoring of the therapy compliances, sir. Next. The major three takeaways from this, sir. One is that for every 100 rupee or every 100,000 Indian rupee, we are able to serve 4 children in a year, sir. Otherwise, it will be only 1. And then it increases the school enrollment 8 times, sir. The national average, again the figures are not very accurate. We have to go by only the national sample survey. The current success rate for our area is 85% school enrollment, sir, at pre-primary level. Otherwise, it is about 10 to 15% nationally. In Tamil Nadu, it is much better, sir. The third important thing is 73 out of 100 parents are improving in their economic and social conditions, sir. Because we have, the surveys show there is a substantial reduction in their stress. All these 3 outcomes that I am mentioning are well published in international journals, and we have also won awards, sir. And we presented it in the international conference 2 years back, just before the pandemic, sir. And Bhagwal Prohitji inaugurated and launched our entire program, sir. It is at that time he also gave the contribution of 51 lakhs for our compound wall, sir. That is now you are good self inaugurated today. Next. So this is the architecture, sir, for the entire program. You're connecting people with the workers and the children get benefited at the end of the day. Next. This is how we have progressed, sir. Today we have more than 144 children with children who have been screened and 5,400 children who are getting the services. And we have got several partners, sir. It is easy to roll out this whole program. So there are more than 7 NGO partners, 6 states we are working, sir, including Varanasi, our Prime Minister's constituency in Uttar Pradesh. And we have got MOU with the state government of Tamil Nadu, sir. Last week we signed a MOU with the Education Department also, sir, for supporting the Samagra Shiksha Abhiyan, for bringing this solution to make a big impact, because our solution extends up to age 18, sir. So it can be used by the schools also, and we have made an MOU with them, sir. Our ultimate aim is by 2030, I won't say an ultimate aim, it is our aim, an interim aim, is to reach at least 100,000 children by the turn of century, sir, by the turn of this decade, sir. So I request you, sir, to give us the necessary input and guidance and blessings on in this regard. Next. We do the training, technology, support and value-added service, sir. Next. Next. This you can skip. This you can skip. These are all our partners, sir. Various universities. The government of Tamil Nadu is also one of the partners, sir. Various other NGOs are also there, sir. And Kalasarikam University is also a partner who is a local university, sir. Grand Challenges Canada is our biggest funder for developing this entire initiative. Handicare International is our great inspirational supporter for the last 30 years, and they are partnering with us in developing this entire application. Azim Premji Philanthropic Initiative, that is Azim Premji Foundation, is also a big partner for helping this entire program for the last 4 or 5 years, sir. There are several other corporates also helping us, sir. Next. This is our team, sir. Ramakrishnan is there, and Dr. Dinesh is from Canada, is from Toronto, then Rajeshwaran, then Nalamani is our training head, and Mary Brain is from Toronto, Kalyani, wife of Rajeshwaran, is the technology head, and Franzina is our research head, sir. So this is our team, sir. We all seek your blessings, sir. Next. So we want to dedicate this, sir, to our nation on our 75th year of independence with your blessings. We want to be part of this whole country. Several people have sacrificed their life for our independence, and we all hope that we people with disabilities will be taking a big part in developing this nation, sir. We don't want welfare, we don't want any sympathy. We only want opportunities, sir. We take pride in providing services to the nation, sir. If you give us an opportunity, we will go to the war front and fight also, sir. Thank you very much.